Hello everyone, my name is Christy Greenlee. I did my geriatric syndrome case study on dementia, so I will be discussing this further in the slides to come. Dementia is a syndrome that is chronic and progressive in nature. There is deterioration in cognitive function beyond what might be expected from normal aging. It affects memory, thinking, orientation, comprehension, calculation, learning capacity, language, and judgment, but consciousness is not affected. Alzheimer's disease is the most common cause of dementia. The burden of Alzheimer's disease and related dementias in 2014 involved 5 million people. This burden is projected to grow to 13.9 million by 2060. Among these people, African Americans have the highest prevalence of Alzheimer's disease and related dementias at 14%, followed by Hispanics at 12% and non-Hispanic whites at 10%. Alzheimer's disease is the fifth most cause of death for Americans ages 65 years and older. The significance of dementia on the nursing profession includes social and economic issues in terms of direct cost, medical cost, social cost, and informal cost. Physical, emotional, and economic pressures can also cause great stress to patients and their caregivers. Supports needed from the health field, social fields, financial teams, and legal systems for both people with dementia and their caregivers. There's expected to be a dramatic upsurge of dementia, as we mentioned before, by 2060. That can also lead to a significant nursing shortage. The subjective data noteworthy for my patient was that she didn't have any allergies, current medication regimen, she's on aspirin, 81 milligrams a day, atorvastatin, Aricept, and Protonix. Her immunizations are up to date. Her preventative care is all up to date as well. Past medical history that she has is coronary artery disease, hyperlipidemia, dementia, and GERD. And coronary artery disease, that we'll learn later, is also linked to dementia. The typical presentation of dementia patients include confusion, disorientation to time, place, and person, impaired short-term memory, and cognitive dysfunction. Common complaints from patients and families include poor judgment, personality changes, decreased spontaneity, increased anxiety, memory impairment, inability to perform activities of daily living, shortened attention span, language difficulty, inability to recognize familiar people, reduced mobility, weight loss, incontinence, groaning, moaning, grunting, and dysphagia. The objective data noted with my patient that corresponded with dementia was noted with her musculoskeletal system. She had a slow and unsteady gait and decreased balance. And then her psychosocial, she did not make eye contact, she had a flat affect, and she was unable to follow multiple step commands. The screening tools that I used, the first one was the mini mental state exam. My patient scored 15, which was moderate impairment. It's a 30-point questionnaire. It takes about 5 to 10 minutes to give it. It focuses on orientation, function, attention, calculation, and the ability to follow simple commands. A score of 0 to 10 is severe impairment, 10 to 20 is moderate, 20 to 25 is mild impairment, and then 25 to 30 is no impairment. I also used the Frail questionnaire on her. She scored a 2, which was pre-fail. It's a 5-question assessment of fatigue, resistance, ambulation, illness, and loss of weight. Patients who score 0, they're robust. They can get up and ambulate and Pre-fail is 1 to 2, and then frail is score 3 to 5. The next screening tool that I used was the Global Deterioration Scale. It provides an overview of cognitive function. It's broken down into 7 different stages. Stages 1 to 3 are pre-dementia, 4 to 7 are dementia stages. Beginning at stage 5, the patient can no longer care for themselves and need a caregiver. Stages 6 and 7 are severe. My patient in this study was at level 5, so she does need a caregiver, who is her daughter. And so I did the Zaret burden interview. It's a self-reported measure, 29-item questionnaire. The caregiver is asked to answer the questions using a 5-point scale. Response ranges from 0 to 4. Interpretation of the score 0 to 20 is little to no burden, 21 to 40 mild to moderate burden, 41 to 60 is moderate to severe burden, and then 61 to 88 is severe burden. My patient, the caregiver, scored at 18, and so in this situation we get home health in there and a social worker to see if we can help her with respite care. The treatment for this patient includes continuing her AirCept. Social interventions include environment modifications, ensuring she has grab bars for the shower, the bathroom, raised toilet seat, handrails going in and out of the home. She needs constant supervision, assistance with activities of daily living, and IEDLs. She needs structured routines, things that do not rely on her memory. And then differential diagnosis includes depression, delirium, mild cognitive impairment, MS, hypothyroidism, syphilis, vitamin B deficiency, and rheumatoid cerebral vasculitis. The diagnostic and screening tests include a CBC, CMP, TSH, serum B12, syphilis serology, and a UA. Non-contrast CD will detect vascular insults, and then instruments that assess her orientation, attention, calculation, such as the screenings that we did before. And then the final diagnosis for her was vascular dementia. The supportive information included gradual onset, progressive memory loss, alert but disoriented, poor judgment and difficulty finding words, and frequent near-miss answers. Personality changes presenting as anxiety and depression, disturbances in gait, labs within normal limits to rule out other findings, and then the CT scan showed no cortical shrinking. Barriers to plan include cost of care, complications from dementia, include immobility, swallowing disorders, malnutrition, and increased risk for pneumonia. Some of the community resources that we have here locally, in Morristown, the Regency Retirement Village, they have also a locked unit for when the dementia gets more severe. We have Wellington Place of Newport, Greenville, Sevierville, and Johnson City. Agency on Aging and Disability. Home care and hospice agencies are really available to help or teach caregivers on the disease process and management, and also physical therapy to go with that. Skilled nursing facilities if the caregiver can no longer provide for them. And then here in Morristown, we also have the Alps Adult Day Services Center. With dementia, it certainly takes a multidisciplinary team. Neurology is involved, geriatric psychiatrists, geriatric nurse practitioners are available, mental health nurse practitioner, clinical nurse specialist, psychology, support groups for patients and caregivers, and then physical therapy to help them. Some health behaviors that are associated with dementia include anxiety, depression, memory loss, word searching, and flat affect. So we have to make sure that we also treat the patient's anxiety and depression, keep that stable. Social determinants that put you at increased risk for dementia include being a female, increased age, genetics, depression, cardiovascular disease, hypertension, diabetes, smoking, and obesity. Increased risk with low educational levels and low lifetime achievements. And then there's a huge economic burden from this disease because it can take many years of treatment. Culture issues, there's an increased risk with blacks and Hispanics. Legal issues, ethical issues, benefits, do good and the best, act in the patient's best interest. Do no harm, respect for their autonomy versus their paternalism. You want to give them as much freedom as possible, but ensure that they're safe. In conclusion, dementia has a slow and progressive onset as compared to rapid onset with delirium and depression. Patients are alert with dementia when they're not with delirium. They have decreased alertness. Sleep-wake cycle can be fragmented, disturbed, and or reversed, as we see with sundowners. Not only is memory affected, but personality and mood changes may also occur, and they have to be managed as well. Treatment plans can be comprehensive and include biological, psychotherapeutic, social, family, and pharmacological interventions. And these are the references I use to complete this assessment. Thank you.